Welcome, everyone. Good day, everyone. My name is Iano, and on behalf of every one of us at HSB Innovation Translation Lab, would like to welcome you to our demo day. First, a special thanks goes out to every single one of you who have chosen to spend the next hour with us. Thank you to our judges, to our investors, to partners, to mentors, to innovators, to our founders, last but not the least. Thank you for showing up today. Today is basically what happens when great ideas meet the right solution or the right support system, rather. At HSB Innovation Translation Lab, we found a gap between having a great idea and being able to execute on that idea to get into the market. We are focused on research-backed validation of health innovations. It's more than just proving that an idea is great. It's more about building enough evidence to show that that solution will work in the context it was designed for. We are working with early stage founders who have identified an important problem and are already building solutions to address that problem. We answer important questions like, is this problem significant enough? Does the solution solve a genuine need? Will the people who need it be able to adopt it? Can it fit the realities of the market in which it's being built? Is there a sustainable business behind that innovation? Over the past 6 months, our founders came into the lab with different ideas, different questions, different assumptions, different ambitions. And since then, we've been able to work with them on their customer discovery journey, helping with regulation, helping to refine their business model, helping with stakeholder engagement, and many more. Today is just the result of what has been going on for the past couple of months. And I would like everyone in this room to be very generous with their insights. So today is about helping our founders to live with better questions, to live with sharper thinking and clearer next steps. And to our founders who have spent the last couple of months building and showing up, enjoy these moments because everyone gets to see just a few minutes of what you have been doing over the past couple of months. But we know that it has taken you much longer to be able to get there. So let's get started. Now let's meet our judges. We're fortunate to have judges who are bringing wealth of experience from investment to entrepreneurship to healthcare to innovation. Let's meet our first judge. So while the presentation is coming up, we have two judges today. And like I've said, they're coming with a wealth of experience, which we know would be really, really helpful to our founders. It would help them to, it will guide their journey, it would help them to pick out things that they need to do much better, things that they are doing very well, and the things to look out for in the next couple of weeks to months as they continue building. I'd also like to point out at this stage that our founders go ahead,
Bio of
please.
Ashimi Farm. Opialua Ashimi leads Promain and Promade, which bridges healthcare gaps in low-income Nigerian communities by digitizing primary care and forming high-impact public-private partnerships through Promain and Promade's care initiatives and Care AI and DigiWomen. Ashimi is enabling early disease detection, expanding digital literacy, and streamlining healthcare delivery to improve health access for over 10 million people, with an emphasis on women in rural areas. Her work strengthens community health systems and equips frontline workers with digital tools to deliver timely, effective care where it is needed most. Farm. Ashimi is currently a mentor for women, entrepreneurs of the Tony Elumelu Badia Entrepreneurs Program and a mentor for health startups in UNDP Timbuktu Africa Program. Ladies and gentlemen, let's make welcome Farm Ashimi to the HSB ITL Demo Day.
Thank you so much. We're delighted to have you here with us on the show.
Bio
Let's
of
have our
Ashimi
second,
Farm.
waiting for our second judge. We have, really great people in the house today. We're delighted to have you here today. Let's have the second judge. Okay, I can already see her pinned to the screen. So while we wait for our presenter to play it, I would like to know, how do we pronounce your name properly? Because we don't want to mispronounce your name.
It's Dagmawi.
Dagmawit. Nice to meet you
Yeah.
here today. And
Nice to meet
you. Yeah. Okay, please let's have our second presentation.
Yeah, I'm trying to share my screen. Just a second, please.
Reading the bio.
Okay, apologies on that, but let's get the chat moving.
Now, reading the bio of Dagmawit Mengistu, Dagmawit is an operator who started her career at Deloitte in talent acquisition, developing an early instinct for spotting potential that credentials alone don't capture. She then moved to IDEO.org and IDEO's Collab Venture Studio, working across financial inclusion, gender lens investing, and digital access in sub-Saharan Africa and Southeast Asia. Her current work focuses on equipping venture capital firms with tools to integrate responsible investing in emerging markets. She arrives at Dream VC with an evolving thesis and the belief that lasting impact in the African venture ecosystem is built on inclusive market share, not charity. She holds a BA in International Affairs from UC Irvine and a Master of Public Policy from the University of Chicago, and is based in the Washington, D.C. metro area. Community building shows up everywhere in her life, from running the front desk at a local bar, studio and learning the rhythms of a small business, to cooking, baking, and seeking out cultural events that keep her rooted. Ladies and gentlemen, we welcome Dagmar Whitman-Gestu to the HSB ITL.
Welcome. We're so glad to have you here with us today. Let's have in the chat, where are you joining from? What do you currently do? While we wait for our founders to present. So we have three founders here today, three different innovations, entirely different innovations, like in three different spaces in healthcare from different countries. Our first founder today is solving for one of the biggest health challenges globally, cardiovascular health. They are leveraging technology in the diagnosis of cardiovascular disease. Join me in welcoming the founder of CardioSense, Christian Omara. So while we're
Hello.
waiting for him, great. While we're waiting for him, he's going to be presenting, and then afterwards, we're going to be taking questions from the judges. Your time starts now.
Okay. Good evening and good afternoon, everybody. Am I audible enough?
Yes, very.
Okay. My name is Omara Christian Kenneth. I'm from Kampala, Uganda. I'm the co-founder and the CEO of CardioSense. Before we begin, I would like to pose you a question. When was the last time you had your blood pressure checked, your weight, your breathing? So as we begin, I would like to introduce you to CardioSense. Now, meet John. John is a farmer in rural Uganda. He's a hardworking man. He has a family to feed. He wakes up with a chest pain and his nearest clinic is 20 kilometers away. When he finally arrives, the clinician does an ECG, but there are no immediate flags that his heart muscle could be dying and he's liable for a heart attack. So then John leaves without knowing whether he should be referred or should be worried. So this is the problem we are trying to solve. Vascular disease currently kills 13% of people in sub-Saharan Africa, and about 31% of Ugandan adults have hypertension. In Uganda alone, 18% of its premature deaths are due to cardiovascular disease. It's not a problem of infrastructure, though some parts of it is. It's not that clinics lack ECGs. What we're missing are the experts to read them. Sub-Saharan Africa has a ratio of 1 to 1,000 patients per cardiologist versus 1 to about 13,000 in the US. Africa alone has only 2,000 cardiologists servicing 1.2 billion people, and fewer than 18% of the countries have 10 cardiologists. So here's how our solution works. Minimally trained health worker, a nurse or a midwife or a community health worker captures ECG using our lightweight device. The ECG pre-processes the signal, feeds it through a dual branch AI model that combines ECG and clinical risk factors and returns a risk assessment in 60 seconds. The device is easy to use. It works without internet, and the AI model works on the device, so it's deployable in rural settings. So the current cardiovascular diagnostic market is at 3.8 billion today, and it's growing at about 50, and it will grow to about 15 billion by 2035. The reason why we think it is growing is because there's rising cardiovascular prevalence and there's better AI diagnostics on the market these days. Why CardioSense stands apart is because we have been training on African data, so it better suits the African population. Another thing is it works offline, which helps because a lot of these facilities are in rural areas and there's less accessibility to the internet. In the competitive field right now, we have a gap in the market because a gold standard, which is cardiologists, are rare and rarely in reach. The advanced ECG machines are bulky and expensive. And a lot of the telemedicine platforms and wearable devices are pretty expensive for the population that we are trying to target. So how we are going to generate income is direct device sales and subscription-based services to people that will be using our AI system. So our early traction, we have presented 2 papers at NCD conferences. We have version 1 and version 2 of the AI architecture designed, and we are working on validation. We have also secured our first partners, our academic partner, Alliance for Medical Research in Africa, and HSB ITL, and we have won a bit of pre-seed funding. Our next steps are to design our pilot study and publish the results, and hopefully start to scale. Our asking budget is $100,000 to $125,000. This will go towards funding the pilot program, the regulatory approval, and early manufacturing for the device. Lastly, my team is composed of very, very, very hardworking people. Dr. Patricia P10 from Kenya is co-founder and lead of our clinical validation team. And my CTO, Obal Emmanuel, he's in charge of the hardware development and part of the machine learning. Thank you all.
Thank you so much for your
I think that's
presentation.
okay.
Let's have, some virtual claps. Let's show him some support. He's been building for a while now, and this is just a detail of what he's been doing. So we'll start with our judges. Would give chance for our judges to ask questions. So I'll start with from Ashini.
Hello, Omara. Thank you for a wonderful presentation. My first commendation for you is, being able to stay the course all through the whole program, and also to be able to validate your idea to the point where you're now ready to present your pilot findings, and also securing partnerships that would ensure that, your publication of your pilots will be well accepted by regulatory authorities. My question will then come around intellectual property protection. Since you're building a hardware as well as a software component with it for subscription base, do you build internally based on your team composition? You have somebody who's in charge of the hardware. So what does intellectual property protection look like? Are you licensing to others to produce for you? What's your plan for intellectual property protection?
That's a very good question. Thank you so much for being on the call. For intellectual property, for now, we want to register the AI model first, because especially medical hardware, there's a lot of regulations. So we are also trying to find a way if it would be cheaper to have somebody manufacture, but the idea is to have our own product and license it, but we are not yet at that stage yet.
What gaps do you see in your team that you think, as you go through your pilot studies, what gap do you see in your team composition that would help you accelerate growth to the point where you're commercially viable?
For our team so far, I think it's a bit so technical. We need somebody who's going to help us do marketing and reaching out to stakeholders. I myself, I am a biomedical engineer by training. My CTO is also a biomedical engineer. And then we have a doctor who is just trying to validate. So we have a lot of gaps. We need somebody to talk to stakeholders, somebody to market, somebody to look at VCs. So we are building on the teams.
Thank you.
Thank you so much. Please, let's have questions from Dagmawit.
Yeah, thank you, Omara, for telling us about CardioSense. My first question is about whether you've built any strategic partnerships yet while you've been testing. So maybe local health facilities that are willing to potentially try your product, or government health authorities that are also willing to try your product. I'm curious about what strategic partnerships you may have built so far.
So far, let me give you up to about last month. Initially, we got our academic partner. Because we were training an AI model, we needed data, and they had access to African data, which was good. And then in terms of more strategic partnerships, we started talking to a professor here in Uganda. He is helping us with the ethical kind of pathway. He said, I met him through this lab actually. He is helping us with that front, trying to reach out to health facilities and to other partners. So we are trying to work with him to get us in.
Better question would be, I guess, who are your ideal, like dream partners that you could have for this?
Our ideal partners would be majorly hospitals, ministry, government, for say, because they have the access to a wider network of community health centers, which we are targeting primarily. That's where we want to deploy the device, and ministry and governments have a wider kind of reach for these centers. I would say governments and let's say Ministry of Health first, then major hospitals.
Okay, I'll stop my questions there for now, but this was very interesting. Thank you, Amara.
Thank you very much. Let's have another round of applause for both our founder and our judges. So our second team today is working to transform cancer care journey through technology. Let's have Olam.
Good evening, everyone. Can everybody hear me?
Yes, I can.
All right. Okay, so can everybody see my screen?
Hold on. Yes, we can.
Can everybody see my screen? Can I be heard?
We can. Yes, you're
Israel is
heard.
helping him.
Okay. Israel is sharing for you.
Sorry.
Do you want it to share for you, or would you like to share for yourself?
Okay. Can you see my screen? I'm sharing the screen now. Can you see my slide?
We're seeing Israel's slide, not yours. Do you want him to stop sharing?
I can see Uncle Spare. I can see.
Okay.
Yeah, it's
Okay. So
okay.
So is I can share from my hand. I just want to
Israel, stop
confirm that.
sharing, please. Yeah, let him share. Thank you.
Okay. So can you see my screen now?
Yes, we can.
All right. Thank you very much. All right. Lastly, I just want to confirm that everybody can hear me.
We can hear you. Please go ahead.
All right. So meet Mrs. Adebimpe. Mrs. Adebimpe was a family friend. She was a mother of 5 children. However, unfortunately, Mrs. Adebimpe left her children behind as a result of breast cancer. It started when she noticed a lump in her breast. She delayed care, probably because she could not feel pain, or maybe because of the fear and misinformation that surrounded cancer. She had visited a lot of traditional centers, a lot of spiritual centers, waiting for a miracle. But the cancer grew worse and the prognosis became bad. Eventually, she visited a lot of health facilities before finding a consultant, but at this time it was already too late. Sadly, Mrs. Adebimpe died on August 2016. Now, the question is, what killed Mrs. Adebimpe, or what led to the death of Mrs. Adebimpe? Was it cancer? I'm very sure majority would think that cancer actually led to her death. But can I put it to you that Mrs. Adebimpe died as a result of late presentation? And Mrs. Adebimpe's case is not just a singular case. She's just one in 80,000 people that die yearly of cancer in Nigeria. And I'm sure that majority of us know someone that has died of cancer and can attest to the fact that they either presented late or got care very late. And this is why Oncosphere is built, to help close the gaps that leads to delay, which eventually is responsible for late presentation. Nigerians experience substantial delays across the cancer care continuum, and this drives late presentation and leads to worse outcomes. And this is as a result of lack of awareness of symptoms, fear and misinformation surrounding cancer, delay in getting screened, poor health seeking ability, and late diagnosis. And this is where Oncosphere comes in. Oncosphere is about integration, not just another singular feature or solution. Oncosphere encompasses AI-powered risk assessment, cancer education, connecting people with screening, diagnostic, and treatment centers, teleconsultations, pharmacies, and hand-to-hand patient navigation. All right. Can you see my screen? And can I still be heard?
Yes.
All right. Thank you very much. Now, Oncosphere for the first few years is going to be focused on breast cancer, cervical cancer, and prostate cancer. And this offers a large and growing opportunity of about 11.12 billion naira annually in Nigeria. And our hope is to capture just 5% of this market size or market opportunity, which is about 556 million in the space of 3 years. And how we plan to get our revenue is through teleconsultations, referral commissions, premium navigation and subscriptions. Now, telecom consultations. Now, currently in Nigeria, there are only about 100 oncologists or oncology specialists in Nigeria compared to being able to handle over 220 million population and about 127,000 plus people that are newly diagnosed of cancer yearly. And so Oncosphere will come in, connecting people with oncologists right from the convenience of their home, and also referral commissions. Now, Oncosphere will be partnering with hospitals, cancer centers, and patients that are referred to these hospitals. We get referral commissions from them. And also patients that are willing to ask for premium navigation will also bring in revenue to Oncosphere. Now, how do we plan to go about how do we plan to get our users? Of course, through social media campaigns and promotions, targeted community outreaches, and we'll be partnering with NGOs and partnering also with hospitals, oncologists, health providers, and pharmacies, and later on financial institutions to help to broaden our scope and support our services. And this will be put through by a team of 5. I'm Olamide Odushola, the founder of Oncosphere, and I have working with me Boluwatife, who is in charge of research and operations, Maya Mudashiru, who is a full-stack developer and data scientist, Ayoluwa, who is a UI UX designer, and Oluwafemi, who is an AI and machine learning expert. Now, how do we plan to achieve these? Of course, we need about $10,000 just for the first phase that will help us with our website and cloud infrastructure development, our AI and product development, regulatory compliance, health provider and treatment center onboarding, and social media and community outreach campaigns. And we're also seeking for strategic healthcare partnerships and mentorships in digital health and healthcare commercialization. Thank you very much.
Thank you, Olamide, for that presentation. So we'll take questions first from Dagmawit, and then we'll take from Ashimi.
Hi, Olamide. Thank you so much for telling us about Oncosphere. I'm curious, what is the what's your customer acquisition strategy? So how are you actually going to be testing out Oncosphere when the time comes? And how will you get, how are you going to get people to essentially like come to you? What is the value proposition for them? And what is your customer acquisition strategy?
All right. Thank you very much. So I'll just like to go back to the go-to-market strategy. So of course, we'll be getting our customers through social media campaigns and promotions. And what we'll be proposing to them is the fact that Oncosphere is just not another single solution or feature that we have there. A lot of companies, a lot of organizations are only focused about one aspect of cancer. And we discovered that cancer has to be coordinated. The solution has to be coordinated. It has to be integrated. And so our value proposition is that we are looking at AI-powered risk assessment. So people get to know their risk of cancer and also get to become educated about different kinds of cancers. For example, cervical cancer, most people don't know that when they get vaccinated, they are free from getting cervical cancer for about close to 90% of them of the virus that causes cervical cancer. So we're also offering them cancer education, and then we're also connecting them to screening, diagnostic, and treatment centers, because a lot of people delay in the process of getting screened, and also in the making of the diagnosis of cancer, and also in getting treated. For example, Mrs. Adebimpe waited until it was already too late. Imagine we have something like Oncosphere. She could just get her phone and speak with an oncologist directly from her house. And of course, that's where teleconsultations comes in, and also connecting people with pharmacies where they could easily get chemotherapeutic drugs or immunotherapeutic drugs. And lastly, hand-to-hand patient navigation. So this is our value proposition.
And I will ask you, what's the biggest challenge for you all right now for Oncosphere, like in terms of launching or even doing some sort of like product validation? What is your next challenge?
All right. Thank you very much for the question. So at the moment, I think the major challenge, or let me say milestone that we're looking at overcoming, is getting hospitals and treatment centers, pharmacies, diagnosis centers, clinic centers on board in our platform, because of course these are our key partnerships. We're trying to connect people to these hospitals, to these centers, so they could easily book and get access to care. So that's a major milestone for now.
Okay, thank you so much.
Thank you very much.
Thank you so much, Ashimi.
Well done. Thank you for a good presentation. It was really nice to hear how you've progressed so far in developing this idea. And I like what you say here, integration, not another single feature. It then brings me to back to your go-to-market strategy. What kinds of integration are you looking at with existing platforms already when you're thinking about your go-to-market?
All right.
strategy?
Thank you very much. If I get your question correctly, you said what kind of integration are we looking at?
In terms of your go-to-market strategy with already existing platforms that are either doing community outreaches, campaigns, or telehealth within the cancer care ecosystem.
All right. All right. Thank you very much. So the integration we are looking at is majorly, I think I should go back to my value proposition. Okay. So here, how we go about this, working with NGOs, for example, is that most times a lot of NGOs actually are the ones that go into communities, rural areas to get people screened, to get them checked, and to talk to them about cancer and all that. So we're partnering with NGOs that will take Oncosphere to those communities and have people assessed on their risk of getting cancer. And from there, people that are noticed to be high risk can therefore be linked up with hospitals, with oncologists on the platform. So the existing solutions that we have now, or the landscape of cancer management we have now in the country is that we have oncologists, we have screening centers, we have diagnosis centers, but these are almost not visible to people. So Oncosphere is coming in to connect these solutions together and make them visible to people. And then partnering with NGOs, they can take Oncosphere to communities, get people screened or get people assessed rather, and then connect them to screening centers, diagnosis centers, and oncologists. I don't know if I answered your question correctly.
You did. You answered my question. My second question would be, what would then be the legal structure that Oncosphere plans to exist as, considering the regulatory landscape that you're probably going to have to navigate, especially when you're talking about specialist care in Nigeria, at least?
All right. Thank you very much. So how to navigate that aspect is by bringing in advisors. So we're going to have a board of advisor that is. So we have oncologists on our team that are going to be our advisor. We're currently working on getting 2 of them, an oncologist in Lagos and also one here in Ibadan where I stay. And so these people are going to be advisors. So that kind of gives us credibility, right? That helps us with the legal aspect. And also we are working on also getting a lawyer who is well experienced in intellectual property to be part of the board of advisors. And so I believe
I'm not. I think you got my question. I'm saying, how do you exist as a legal entity? Your CFC status. Are you going to be a social enterprise, non-profit, or a for-profit? What do you see Oncosphere existing as, based on the dynamics of what you're bringing to the market?
Okay. Oncosphere is definitely for profit. While there's also a social enterprise side to it, which is through the AI-powered risk assessment, which is going to be free. Oncosphere is also going to be making profit through teleconsultations and also referral commissions. So Oncosphere is going to be a registered company and it's going to be for profit.
Thank you for your time.
Thank you, ma'am.
Thank you very much. Thank you very much. And we have another round of applause for our founder. So now we are going to the final team for the day. This team is solving for or is tackling a challenge in that many hospitals face. Many patients face this problem, ensuring that there are life-saving medications that are available when needed and also reducing avoidable waste. Welcome, Kojo.
Hi, good afternoon, everyone. Can you all hear me?
Can hear you.
All right. Good afternoon, everyone. My name is Cody and I'm a pharmacist. So before I begin, can you give me an emoji if you believe expired medicines should always be destroyed? Most people would agree and they are right. But what if we could prevent some safe surplus medicines from ever becoming expired in the first place? Every year in Nigeria, NAFDAC destroys millions worth of expired medicines to protect the public health. At the same time, over 60% of Nigerians struggle to afford essential medicines, and most health spending is paid directly by patients, making treatment unaffordable for millions. Now, let me introduce you to Mama Aisha, Mama Aisha is a 52-year-old market trader in Lagos, Nigeria, living with hypertension and diabetes. She needs medicines every day just to stay healthy, but rising medicine prices force her to skip doses because she simply cannot afford them. The irony is that just a few kilometers away, medicines that would have been used earlier remain unused until they expire because there is no social system to distribute them safely. That is the gap our drug reach is trying to solve. So Drawbridge is building Nigeria's trusted medicine distribution network. We coordinate two simple models. First, if hospital A has eligible surplus medicines it will use before expiry, we connect it to hospital B that needs them urgently. Second, when those medicines are suitable for vulnerable patients, we coordinate distribution through internally displaced persons, IDP camps, short-term outreach programs, humanitarian groups, mission groups, where qualified healthcare professionals dispense them using valid prescription. So every transfer is verified, documented, and traceable. We create value at every point in the chain. So every stakeholder benefits: the patients, the hospitals, the groups, and the regulators. So for our market size, we estimated our market using a top-down approach. So Nigeria has over 48,000 registered healthcare facilities and pharmaceutical premises. So we are initially targeting private hospitals, mission groups, IDP camps, and primary healthcare centers in Lagos before expanding nationally. So this represents a multi-billion naira coordination opportunity, beginning with the regulatory sandbox pilots across 15 facilities. So how exactly are we making money? So Drawbridge earns revenue by providing coordination and traceability services to participating healthcare institutions. So during the pilots, we are validating the willingness to pay while supported by catalytic funding. So for our validation, what we have done so far, Drawbridge is built on evidence, not assumptions. So it began with my undergraduate research on pharmaceutical waste management, followed by community awareness campaigns on safe medicine disposal. So through this work, I identified a critical gap between medicine waste and medicine access. And since then, validation has been done through engagements with relevant stakeholders. So this validation has now progressed to regulatory engagement. Yesterday, I had the opportunity to present Drawbridge to the Director General of NAFDAC, who encouraged us to refine the concept into a carefully supervised pilot involving the appropriate directorates at NAFDAC. So for the competition, existing solutions, they mainly facilitate medicine trading and informal exchanges. Our biggest competitive advantage isn't technology, but it is regulatory alignment. So our next milestone is submitting a revived proposal to NAFDAC to commence the discussions on the regulatory sandbox pilots involving donor hospitals and receiving groups. So within 3 years, we aim to partner with over 150 healthcare institutions. We distribute more than 700 million worth of medicines and reach approximately 75,000 patients. So we are intentionally starting small because trust must come before skill. So solving this problem requires expertise in pharmacy, regulation, and technology. So my experience as a pharmacist and current role at NAFDAC gives us an understanding of medicine regulation and pharmaceutical waste management. So Adadi Bolale brings experience from Vanguard Pharmacy, one of Nigeria's leading pharmacy chains, while our technical lead is building the digital infrastructure for secure medicine traceability. So today we are asking for a sum of 20,000 USD, in which 45% will be used for pilot implementation, 25% will be for data platform development, 20% will be for regulatory validation and compliance, and the last 10% will be for monitoring and evaluation and stakeholder engagement. So alongside regulatory guidance, we are also looking for pilot hospitals and strategic partners who want to help us build this responsibly from day one. Our vision is simply to build Nigeria's trusted medicine distribution network while improving access to equitable access to essential medicine, while also reducing pharmaceutical waste. So together we can build a future where medicine saves life before it becomes waste. Thank you very much.
Thank you so much for that presentation. So we'll take questions first from Famashimi and then we'll take from Dagmawit.
Kadre, thank you for the thorough work you have done in terms of, engaging with key stakeholders. You put in a lot of effort, I can see, in terms of regulatory, safety, compliance. My concern would be your go-to-market strategy. You did say that sourcing is not the problem now. It's who your distributors this drug to. You have a B2B to C parity, if I can, if you could go back to your slide on go to market. So how do you ensure that these near expiry drugs actually get to the patients who need them? How do you navigate that? Because where the drugs are is not the problem. We know where the clusters of pharmacies and hospitals are. The issue is how do you know the patient that needs it and the patient will use it within that time frame before it expires?
Okay, all right. Thanks for the wonderful question. So first of all, we need to get regulatory approval in everything we do. So as for the parts of how exactly are we going to get this people, so that is why we are considering some sets of groups like institutions where they are closer to the community. For instance, now the primary healthcare centers are more closer to the community than the general hospitals. So apart from that, we are also looking into connecting with the community pharmacies. And apart from that, we're also looking to connect with like the IDP camps where and also the mission groups. So because all these people are closer to the community than using like the big hospital for the experiment. So besides on our platform too, we also hope that by the time we are also encouraging more groups to be joining by registering their platform so that when they have like people in need, they'll be able to connect with us and be able to know, okay, these are the right people that need this thing at the right time before this thing also gets expired with us. So that is the way we are trying to reach the vulnerable set of people. So I hope I answered the question very well.
Thank you. You gave an answer to my question. I will want to go back to your product. What exactly would you be building? Are you building a website, an aggregation platform, or you're creating a distribution channel? What exactly are you building? What's the product? We know the problem you're solving. We know the channels that you're acquiring the drugs from. We have an idea of how you want to distribute that to patients. Or what are you building that would make all of that possible? That's my question.
Okay, as for what you say we are actually building, we are also building a digital platform in the sense that the donors and the we give us. So because on this, that's where we're going to be doing the traceability, the tracking of those people that are coming to give and also the people that will be receiving. But there's going to be like a physical.
Sorry, keep losing your sound. So if you could answer that question all over again, you kept breaking for some reason.
Okay, am I audible right now? Okay, so I said we are going to have a digital platform where we are going to be doing the traceability. So every donors will definitely be registering on our platform, and every receiving groups also will be registering on our platform. So the distribution we are going to be doing is going to be on the platform in the sense that we won't lose any data in the side from the collection side and the receiving side, because everything we are going to be doing, we are also going to be delivering it to the regulatory bodies. So that is the platform is going to, just going to be for the tracking of what we are receiving and what we are sending out. So thank you very much.
I think my final question would be about the legal status of drug bridge. Would it be a social enterprise, a for-profit?
Yes, so I'm really enjoying learning about all these startups, and I do think that healthcare startups and ideas are especially scrutinized by a very like heavy regulatory environment, rightfully so, because you're dealing with vulnerable populations and patients and their health. And for Drug Bridge, one of my questions is, I think to the other judge's question, I see this a lot as being a social enterprise and educating people about the effects of expired drugs and sort of recycling that within the distribution channel and in the system. My question for you is, how exactly are you making money, right? I think if you go back to your slide of your business model strategy, I'm curious if you can just walk us through like how exactly you're making money, and then who, if any, would be your competitors in this space, if you have any. And if you don't, I wonder why.
Okay, all right. Thanks for the question. So as for how exactly are we making money, just like when I was introducing what Drug Bridge is doing, I said we are into two models. So the first one is that when we get that okay, hospital A has near expired medicines, we connect it with hospital B. So with this, we are going to be collecting our coordination fee. So when we get from our hospital A and we get it to hospital B, we get a coordination fee from it. So that is our first way in which we are going to be generating money. So as for the second way in which we are going to be making this ticket to the vulnerable groups through the mission clinic and the primary health care centers and the vulnerable groups and the like. So we are for every medicines they are going to be paying a minimal, very, very low, something very low for them to they will definitely be afford. So through this our pilot regulatory sandbox pilot we are trying to do. So we want to validate these two models, be able to see and get the willingness from and be able to discover whether they are going to pay or not. So these are the two ways in which you are going to be generating money. So others are just through capacity funding and the likes, because we are going to position this thing as a social enterprise, because the focus is to be just to resolve environmental and social problems in the community. So not it is not for profits entirely. So what we are going to will be okay. So thanks for that.
Okay. Okay, so it's not for profit entirely. It's going to be a social enterprise. And in that case, is there anyone else who is doing what you're doing or looking at the problem that you're looking at? Or what does the landscape look like?
Okay. So first of all, let me just acknowledge the international model that is working on this. So we have Cyron is an international model working on what job which is trying to do. So they have been in the market for over a decade. So and also in Nigeria here, we have like other like Divida and also Silanet. But one thing that makes us stand out from others is because we are in alignment with the regulatory body. So everything we are doing, it has the regulatory hands in it. So, but others for now, they are just making it to be an informal distribution market. So those are the people we are competing with for now.
Okay, that's great. Thank you so much.
All right, thanks.
Thank you so much for the questions. I'm sure like they're enjoying these questions because you're challenging them to think even more deeper. So our second judge, Famashini, seems to be having some network issues. So we would close this round now, and then we are going to go into a breakout session for the judges only, for them to be able to discuss and be able to give feedbacks to our judges. We would be, while we're doing that, would give you the chance to be able to ask the audience, to be able to ask our founders questions. Is there anything you'd like to know, how their experience has been? If you want to ask them about their business that they are running, you also have the chance to be able to do so now. But would like to run a survey first, just to be able to get your feel on the three businesses or the three ventures. So there's a poll that has been set out now. You can just click on what you would like to, which of the ventures you would like to vote for, while we wait for founders or judges rather to go to the breakout room. Please let's all vote. It's just a audience choice award. Also, the breakout room is just for the judges. Israel, let's have the questions now.
All right. Thank you so much, Miss Iano. Thank you so much, everyone. Thank you so much to our judges for the wonderful presentation and to our founders too. It has been actually an amazing ride observing this, right? Promising ventures, and yeah, let's see what the future holds for what our founders have presented to us. So from here, we'll be going over to the question and answer session. We have our participants here that I know they may have questions they would like to ask the founders based on what they have presented so far, their idea and the venture they are trying to sell to market, right? So without wasting any time, if the participants, anybody that wants to ask a question to the founders, please you can raise up your hand. I will have to call upon you to do that, please. All right, we have one person. Okay, we have two person, right? Okay, I will start with Sarah. I'll start with Sarah. So Sarah Berola, please unmute yourself and you can have the stage.
Good evening. Good evening. I've been listening since we started this session, and I was truly blown away by the how innovative our solutions were. And I have just a few questions. And my first question is for what you're saying. I was listening to you while you were speaking, and I want to ask, what referral pathway do you have on ground. So how do you ensure that patient does not get lost between screening and definitive diagnosis? I don't know if you got that question.
Question. I see some of you have questions here. Mohammed, your hand is raised. You have a question?
Yes, can you hear me?
Sarah is asking her question.
Can you hear me? I don't know if I'm
Yes, I
ahead.
can hear you, Sarah. I can hear you.
Okay, should I go ahead?
Yes, go ahead, please.
All right, thank you. So I said, what pathway do you have in place to ensure that your patient doesn't, whatever patient is using your platform, they don't get lost between screening and definitive diagnosis? Because, okay, let me just leave my question at that. Thank you.
All right, Uncle Olamide, please go ahead and answer the question.
Okay, I thought you said CardioSense.
Sorry, that was a mistake.
Okay. Thank you very much for your
You said
question.
Yes,
Okay,
Uncle.
can you hear me?
Yes.
Can you hear me?
yes, we can hear you.
All right. Okay. So your question is, what is the referral pathway? How do I ensure that people that are screened or that have assessed their risk of cancer do not get lost between the screening and then definitive diagnosis, right? Okay. So if that's the question, so usually when after screening, what happens, or let me put it this way, after risk assessment, what happens is that every user is going to get a prompt. So every user is going to get a prompt. So imagine that somebody gets screened, or let me say somebody just assessed their risk of cancer and then turns out to be high risk. So there's going to be a prompt on the next thing to do. For example, in the case of cervical cancer, the prompt could be whether to get vaccinated if the person had not been vaccinated, or to go for pap smear, or to go for HPV DNA screening and all that. And so the person is going to receive screening reminders, right? And these are not just prompts. These are prompts that are going to be made easy for the person to be able to assess the next step, the next level of care. So imagine the prompt comes. So let's assume the prompt comes as gets vaccinated. So it's going to, of course, show the user where to get vaccinated, how to go about it, the amount it is, and all that. So it's going to be very easy. And then the person gets reminders, right, on ensuring that he or she takes that next step as prompted. And then the person keeps getting the reminders. So of course, we are making it easy, or easier, so to say, to be able to to deal with delays that makes cancer get worse and leads to late presentations. So I think that's how we ensure that people do not just assess their risk and just forget about it. Yes.
All right, thank you. Okay, and for CardioSense, I wanted to ask, I know you mentioned earlier that your primary audience are community members, like community centers. So I wanted to know what challenges you have identified in primary healthcare centers, like power supply. I mean, for Africans, we usually have issues with power supply, internet connectivity, and staff capacity. So how is your team ensuring that these problems they are put into consideration while the development of your product is going on, and how are you planning to address them also?
Okay, that's a very interesting question. Can you hear me?
Yes.
Okay, so the challenges we have identified, especially with these community health centers, is yes, there's power and mostly internet availability. So we designed that the a model that we trained works on the device. So it does not need an internet connection for it to work. So it works on the device. Then as for the device itself, we are planning to make it something, we are making it something small that uses a rechargeable battery, something that also we can use solar power maybe to charge. So that's how we are trying to tackle the power and the internet issues in the community health center. Does that answer your question?
Okay, Sarah, is that a yes? All right. In regards to the pool is still ongoing. Please, if you haven't voted on the pool, please you can still do that. Not everyone has voted. We still want more numbers to vote on the pool. Thank you. Right. So just like Sarah highlighted, I think talking about referral and electricity is actually a very great concern in regards to what we are building, because the referral, you talk about referral, but actually the referral system in Nigeria is actually weak, right? And we are doing everything possible to make sure that it is strengthened, to make sure that when referring a patient from one health facility to another, right, we don't have damage. Where we are trying to control damage, we have an existing damage, right? So thank you so much, Sarah, for pointing that out, and thank you to our founders, Uncle Sphere and CardioSense, for the wonderful response to that. So I will now, the second, we have another hand raising up, Aminu Mohammed Bello. So Aminu, if I think you have to unmute yourself and, ask your question. Thank you so much.
All right, thank you very much, Israel, for the opportunity. So thank you very much to the founders also for their inspiring presentations so far and their thoughtful ideas. So my question is to Omara, who pitched CardioSense, right? So already my first question has been addressed, which is the power problem and something like that. So my second question is like you made mention of you partnering with an academic institution, with AfriMed or something like that. So to get data for this your your innovation. So I just want to ask how wide is this data coverage? Does it cover the whole of Africa or a certain population of Africa, the only sub-Saharan Africa? And if this data has such limitation, does this limitation impact the performance of your innovation? Thank you very much.
That's a very interesting question. So, as for the data, we got most of it. I think I'm allowed to share this. Most of it was from Senegal. Most of it was from Senegal. It was Senegalese ECG data. Now, there is a question about whether if the model is trained on Western data and African data, if it really makes a difference. So that's a paper we are also trying to investigate. But then, upon speaking to a cardiologist recently, she pointed out to me that these heart conditions basically action potentials. It may not get too technical, but there's an electrical wave of the way the heart works. So she advised that it's kind of standard and the differences in genetics are very complicated to kind of specify out. So as to what you're asking, is it representative of, say, all data in Africa? We don't know yet. We would have to do a pilot study and investigate and sample data from a lot of other areas to make a conclusive.
All right. Thank you very much for your answer. So I'd like to understand if this limitation does it like affect the performance of your model in any way, like the optimal performance of this your innovation.
Sorry, when you say limitation, do you mean limitation in access of data from different areas, or am I correct?
Yes, yes, yes.
Our current model, there's not so much difference with the way the Western population performs and African. But again, I can't make a very solid say, proclamation that it will affect or it may not affect. We are still investigating. What we have right now, there is not so much of a difference. So the data we trained with the Western is generalizing well with the African data set we have.
Thank you so much, Omar. I think this answers my question. Thank you so much for the work you have put so far. I wish you all the best.
All right. Thank you so much, Amin Mohammed Bello, for the wonderful question. And yeah, I appreciate the founder, Amara, for, the amazing answer he gave to that. Right. So far, I don't know if, anyone wants to have a question for them, or we should round up the question and answer session. Nobody wants to ask Mr. Okodri a question for drug bridge. He doesn't have any question. All right. Okay. In the absence of that, I feel like we have to, if you haven't filled the poll once again, please go ahead and fill it. We have to have 100% coverage, right? And now we round up the question and answer session. I'll be putting up the demo video while we wait for our judges to come back and give us the feedback. Thank you so much. Stick around, please.
Yes. Welcome to HSB Innovation Translation Lab Demo Day. Today we are celebrating the people bold enough to build, challenge the status quo, and create solutions that move healthcare from ideas to real-world impact. Let's begin. Over the next few moments, you'll meet innovators solving real healthcare challenges with solutions built for impact. Sit back, be inspired, and enjoy the experience. From
Someone said
innovation to implementation. Welcome to HSB Innovation Translation Lab. where healthcare innovation moves beyond ideas. HSB Innovation Translation Lab Demo Day. Today we are celebrating the people bold enough to build, challenge the status quo, and create solutions that move healthcare from ideas to real-world impact. Let's begin. Over the next few moments, you'll meet innovators solving real healthcare challenges with solutions built for impact. Sit back, be inspired, and enjoy the experience. From innovation to implementation.
Okay. And are you here or do I go ahead?
All right, welcome. You can go ahead now. You're muted. You're muted.
Can you hear me better? Better now? Sorry, I think I'm using some device. Okay. Is it better? Can you hear me now? Awesome. Hi, everyone. I want to say a big thank you to everyone who have made it to today's demo day. We've had a very interesting time. So I'm just going to call on our judges to kind of give us a very quick, recap of what you think about the venture. Just quick feedback. We are about to wrap up the demo day. So I'm going to quickly call on Farm Ashimi. Please can we give a virtual clap for her as she comes on stage to join me as we review the ventures. And then I'd also like to call on Dagmar with today also, sorry, I'm multitasking, to also give us the ventures feedback on how we recommend they go forward with their venture post the transition lab. So I'll start off with Farm Ashimi and then we have Dagmar with. Thank you.
Thank you for taking the time to stay with us this long. And thanks to, our innovators. You guys have done excellently well. You've been bold, you've been courageous since the start of the program to see your ventures to this point. And in the order from the last to the first speech, I'm going to be giving my feedback. I'm going to start with Quadri. Quadri, they're doing something in my space, the farmer space, so I'm particularly excited about Drug Breed, especially the social impact that Drug Breed would have. As we all know, in Nigeria, just 10% of the population is insured, so that means a lot of people cannot afford their medicines. So there's a critical mass of people who have prescriptions from doctors, from their primary health centers, who cannot afford to buy their drugs. So I would say the biggest risk I see in your business is the distribution channel, particularly relying on the communities to get this people, because how sure are you, that the right patient will get the right drug at the right time? Because this is a times critical medicine that you're basically redistributing. So you should actually have a front row seat of the patient that's receiving it. So I'll say when you're designing your platform, design for patient safety so that they can post their prescription. So have a portal where also have a social media page that's linked to maybe your web app that says post your prescription. If we have the drug, you only pay for shipping and you get the drug from us. That way, they have to post the prescription and you have to see the dates that they're going to use it immediately. So if you're sending somebody a drug that's 2 months to expiry and they just have to use for 5 days, they're going to consume it on time. Name of patient is verified. The receiver matches the name of the patient. It's also on the prescription. All of that. So think about that compliance angle for patient safety, data protection as well. If you're able to add that component to your web platform, that would be fantastic, and it will move the drugs way faster. And there will be traceability of who will receive the patient. There's something we call named patient basis in drug distribution, which NAFDAC is also aware. So you can go back to your team leads and your advisors that are based in NAFDAC to also validate this idea. I also like the fact that you've already decided you're going to be a social enterprise. What I would just add on is take the position of the limited by guarantee and you should be fine. So that's my feedback for you. In terms of market readiness, I think you're ready to launch if you can make that adjustment to your platform. So think of limited by guarantee. Speak to a legal person in NAFDAC and they will be able to explain to you what limited by guarantee does. And then that gives you room to research what we call how do we convert expired drugs to new chemical entities. That can be something that builds off of that status. I don't want you to be boxed in non-profit. Give yourself that flexibility to do research on the back of what you're doing, because that could then create a new business idea for you. I will go to Uncle's Fair. Uncle's Fair is asking for $10,000. I think you might need more. a lot of aggregation and reaching out. You might want to hold conferences to aggregate your pharmacists, to aggregate oncologists, to create a lot of awareness. So I would say probably push your ask to what drug bridge is also asking $20,000 as a grant. I would say that the biggest challenge that you would face is the regulatory and compliance risk if you were to register as a for-profit. I already mentioned this during your study sessions at the time that you must be an oncologist to actually exist on CSE as a specialist care provider. It would be easier for you if you took maybe the limited by guarantee model or a non-profit model initially to test your business idea, to get the critical mass, and then you'll see what's more profitable from that idea. There's a huge gap in the market, which is HMO for cancer care. Most of the HMOs currently provide everything else except cancer care. Very few do cancer care. And if you're able to create a critical mass based on this platform you're already building, then you become well known for cancer care advocacy and making things easy for cancer patients and creating that critical mass. Then you can build up a health insurance product targeting cancer care only. And your exit is clear to an investor that once you build that platform, I know that you can exit to a bigger HMO who would want to acquire. Acquisition will then be the pathway that would make you very, very attractive to a private investor. So you might start off as a non-profit or a limited by guarantee initially, but that's just maybe for the first 2-3 years to create critical mass, and then you carve out your for-profit component where you have more clearer understanding of where the money really is, because cancer care is already a very small market, just 100,000 patients per year, and most of them don't have health insurance. So how to make money would be pretty tight if you rush into that business model that you're running. So I would say your market readiness is a tool, but meaning that you need to complete your online platform, but also validate your business model. Don't rush into the for-profit yet. So if you can fix that, that would be great. And you did very well. You actually had the highest score in terms of my own scoring, aside from the fact that there's an issue with the structure that you want to go in with. CardioSense, clear for-profit model. The biggest challenge is your product. Your hardware, you've not decided yet how you're going to manufacture the hardware. You're focusing on the software only, but remember that your hardware is half of your business. And so when you're thinking of your hardware, also think about whoever is manufacturing for you. How do you protect and own your intellectual property? If you can fix that, the second thing you will want to do is to add more commercialization team members to your team, and that would strongly improve your go-to-market strategy as well. And the sky will be the limit. Definitely a venture backable idea. Ask of $100,000 is valid because that's a long road to go, but you need to quickly start thinking about the supply chain management for your hardware as well as commercialization. So that's my feedback, and all the best to all three of you.
Thank you very much, Famashini. Very, very detailed, feedback. As you can see from her profile, she's someone who has mentored a lot of health tech founders. She herself, she has her own healthcare venture she has done. So these are really, really succinct, feedback. Thank you so much. I hope the founders are taking note of all the feedback you're receiving. So now I'll ask Dagmar Waits. Dagmar Waits is obviously going to come with another lens. So please, what feedback do you have for the different ventures in terms of how they should move forward?
Yeah, so I will, given that we are almost out of time, I will keep my feedback succinct, but I really appreciate my fellow co-judge Pharma's very in-depth feedback and targeted actually ways to improve for these companies, given that I am not, a Nigerian healthcare market expert. I will say 3 things though. I think all 3 startups had really strong founder presentations and very strong founding teams as well. Across the board, I've noticed that you all have good teams across product, policy, and healthcare practitioner experience, which is very important. Sometimes founding teams can be very lopsided. So they might have more product people and not enough healthcare practitioners with actual experience. In this case, I think all 3 of you have very strong, well-rounded teams, which is very important. The other thing I'd like to say is to echo Pharma's point of being venture backable. Being venture backable might should not be the most important goal at the moment. It should be to clarify the product market fit, and it should be to clarify, do we have customers here? Do we have enough customers here? And how are we going to acquire them? I kept asking about strategic partnerships because I think for these types of startups, what is going to make the difference right now is getting strategic partners within the space that you're operating in to actually help you expand and get customers and prove that validate your product, validate your problem statement, that there is a problem there and that there is something to be solved. And then you can actually go into making this into a business and actually acquiring customers. I think one of the biggest things is also in terms of launching a product, when presenting a startup, being very clear about what exactly is the product. Is it hardware or software, or does it have both components? If it doesn't have both components, being very clear and outlining which components those are and what the product actually does. I really liked the personification that all three startups had about an actual person and then solving their problems. That's very unique that we don't see always. And so I very much appreciate the archetype of especially the women who would be helped with these products for CardioSense and Oncosphere. I do think that in general, the regulatory compliance and safety pathways were outlined very well. Pharma has more experience there, especially within the Nigerian market. So I'll leave that to her. But I do think you all have a very good idea of the regulatory space of the Nigerian healthcare market. I think overall, I'm very pleased with what I saw here, and I'm very glad that I was able to join and be able to hear these presentations. And I commend these founders for presenting and for really defending their ideas. I think it was very great to see, and I'm excited to see them thrive in the Nigerian healthcare space.
Thank you very much, Mawit. I mean, please, let's keep the emojis coming. Let's keep the love showing. You guys don't know the machines we have. Dagmawit is an expert, in this space. She would don't like to say it, but when I read her profile and I saw that she has worked with Ideal, I remember when I started my journey as a human-centered designer, in healthcare when I was trained by Gates Foundation, one of the models we used was Ideal, right? They told us about Ideal in Stanford, how they design human-centered design healthcare solution. And then we have Famashini here, who is not just a mentor for, the Tono Lumulus Women Program, but she's also one of the mentors for the UNDP Timbuktu program for digital health startups across Africa. And so we're really honored. I want to say a very big thank you to both of you for taking out this time to, mentor and, provide, support to, emerging young talents who are looking to launch a business. So please, let's keep the emoji coming. Thank you. Thank you so much. So I think at this point, we have come to almost the end of today's session. But before I close out, I would like to show the audience choice award, because you guys also were part of the audience and we want to see. There's no winner here. There is no winner here because, obviously founding anything takes a lot of work. It takes a lot of effort. And to us in HSB, we don't see our founders as startups. We call them as institutionals. We are thinking about building functional institutions rather than calling them startups, because oftentimes when people have that name startup, after a while, they feel like it fails and then they give up, right? We are building functional institutions who are going to be able to build companies that will outlast time. So when somebody starts a business, you don't call it a startup, but when it's a venture that has to do with tech, we call it startup. So we are taking a different approach in the IT lab and calling it functional institutions. So now we're going to show you the results of the poll. We had 2 polls, obviously, because of the people who couldn't join initially, and make it live now so we can see. I don't know if everybody can see. Okay, can you see the results of the poll now? Is it visible? Okay, I guess it's not visible. I'm just gonna read the answer and the audience choice. We have more people vote for. We have 5 votes for CardioSense. We have 5 votes for Drug Bridge. We have 3 votes for Oncosphere in the first poll we launched, and then we have the second poll, we have more CardioSense, and then Drug Bridge, and then Oncosphere. So looking at this poll, we can see that a lot of the audience are more aligned towards CardioSense, and then we have Drug Bridge and then Oncosphere. here in HSB, we call them all winners. So we're very excited about, what everybody here is building. Please, can I have the slide on the next word? I'm just going to give you a very brief summary about what we do at the HSB ITL Lab. I know we have time because we plan to end this like 5 minutes earlier. Today's demo day is a testament of, so much hard work from the part of the founders, from the part of the team at HSB Innovation Translation Lab. We have really phenomenal team. I would just like to call their names. Iyanu Olua, who is our amazing lab coordinator. We have Ruth, who has done a great job in our operation. We have Amarachi, who has done a great job also in our internal project. We have Muslimat. We have, so behind the name, we have a lot of people working behind the scene. We have Moses, James, and myself also, who is also supporting the lab in terms of making sure founders. We are an innovation transition lab, and we call ourselves Innovation Transition Lab because what we've observed is that there are a lot of innovation in the market, but the adoption of these innovations is a challenge. The business side of this innovation is a challenge. And so we are the bridge between, founders who have built amazing innovations and making sure that, this innovation gets to the hands of people who need them and people who can pay for them. So we are the commercialization partner for ventures. And we are very excited about our very first cohort of founders, which are these 3 amazing founders. We will be opening up very soon for our next cohort. So as you can see on the screen, if you would like to join, that will be probably sometime towards the end of the year to entry into next year. If you have an idea or you know someone who you think might be interested in joining the lab, feel free to scan the QR code and, sign up. We'd love to have you and support you in building your venture. But nonetheless, today has been a really amazing day. At the lab, we have our internal projects. We also have our own internal project we're developing. We have external projects we support, like the founders you've seen today. We also have provide support, operational support to existing startups. So currently we are working with some startups in Africa and beyond Africa to support their day-to-day operations. So that's what we do at the lab. So if you know anybody or you know our next customer, don't hesitate to reach out and, support us. You can follow us on our social media handle. We are on LinkedIn, Instagram, TikTok, YouTube. I would love to have you join us. We also want to give a very big shout out to our amazing partners who have supported today's program. Have GAD Legal Consulting, which is our legal partner at the lab. And one of our partners from Opelu were also her company Promain and Prodane, who have supported us, by her technical assistance to today's demo day. And also we have Times, which is our financial partner at the lab. So we're very excited. And I want to say a very big thank you to the entire team, to everyone who joined us, virtually. We're very excited to have you today. And so without any further ado, I'd love to close out today's session. The founders can maybe stay behind for just a quick 5 minutes session. Thank you to all our judges. Thank you to all our panelists. Thank you to the audience. You guys have been amazing. Thank you for being here today. Thank you, everyone, and do have a great rest of your weekend. Have a great weekend and rest of your day. Bye, guys. Thank you.